Hi, I'm Dr. Sarkis Bedikian, and I'm an orthopedic surgeon that specializes in hip and knee surgery. If you've decided to have joint replacement surgery, you are going to sit down and meet a surgery scheduler. That surgery scheduler is going to be a point of contact for you. They're going to be your go-to person during the whole process. That surgery scheduler is going to sit down with you and give you a folder. This packet is going to have everything in it, from the clearance forms to the blood tests to the skin protocol to help prevent infection. I would like to highlight this piece because infection is always a risk of surgery. There is a less than 1% chance for all non-diabetics and a higher chance for diabetics that are not controlling their diabetes. We want to make sure you don't get an infection. This skin prep protocol has been used for a number of years by me. We've adopted it through the recommendations, and it's going to help you. The skin prep protocol does include using a soap before the surgery, as well as cloths before and the morning of surgery. Before your surgery, you can expect a phone call from the physician assistant about a week or two before your surgery date. During that phone call, you're going to go over a number of items. One of the things you'll cover are medications. Medications that you take, as well as medications that are going to be prescribed in anticipation of your surgery. In those medications, you're going to talk about a blood thinner you'll need to be on after surgery, medications to help control your pain, and other medications that may affect your post-surgical process, which include nausea, vomiting, constipation, those types of things. Those may or may not help, but we're going to prescribe you medications to help. And that physician assistant is also going to be able to answer any and all questions that you have leading up to surgery. What you can expect from surgery is that you'll come in on the day of surgery and you'll meet the surgical team who are going to get you ready. That's going to entail you to get in a gown, have an IV, talk to the nurses, tell them all the medications you take, tell them all the things you did before surgery, and then you'll meet the anesthesia team. That anesthesia team is going to talk to you about what's the best way to reduce the pain after surgery, as well as giving you the anesthesia. There are two major forms of anesthesia. One is the general anesthesia. That general anesthesia is when you go completely to sleep and a machine breathes for you. The way they do that is by inserting a tube down your airway in order to support your breathing. This does allow us to do the surgery, but ultimately, you may have more side effects than anything. The second form of anesthesia would be a spinal. A spinal anesthesia is where they deliver the medicine in your back, numbing that area, which will numb everything below, so your waist down. But the added advantage is you're breathing on your own, you're gonna take a little bit of a nap, you're gonna wake up and not realize that we're all done. That's a huge advantage because you won't have as much medications in your system to cause nausea and vomiting. After you meet the anesthesia team, you'll definitely meet me on the surgical team. We'll go over the final details as to what surgery we were performing, what side, the right or the left, going over the final details, signing the consent, checking off the final boxes. Following that, you'll meet the surgery team who are going to take you to the operating room, get you set up, and then we're going to get started. If at any point in time after your meeting with the surgery scheduler that you have any questions, feel free to call them or feel free to call us. We're here to help you during your pre-surgical process as well as after your surgery process. And all of this is important to make sure you have a positive outcome.